Hello, happy Women's History Month and happy Hospitalist Day. I have a special guest on Dr. G at the Heart of Healthcare, bonus episode 40. This is Dr. Eva Beaulieu. Did I say it right?
Said it right.
Yay! My French comes in handy.
Good
Welcome.
job.
Welcome to the podcast audience. This beautiful lady, she puts out wonderful content on Instagram. I'm a total fan. And so I just wanted to highlight her in this bonus episode as we celebrate Hospitalists today and Women's History Month. How are you?
I'm great. Thank you for having me. This is exciting.
It's so good to meet you and just to have you here. Everyone listening, the theme of Women's History Month is women who advocate for equity, diversity, and inclusion. How apropos is that? And so I'll just give a brief, just bullet point of view. You're a hospitalist, you're an author, a wife, a mother, a world traveler, with that 7 on, 7 off schedule of a hospitalist. And you told me you're from Haiti.
I'm from here.
So, what else do you want our audience to know about you?
Oh, wow. You did a pretty good job already.
I know,
Um,
I know.
I'm married to another physician, so you can imagine how hectic this is, to balance two physician household. I have three kids. I wrote a couple of books. Oh, you did say author. Um, I think that's everything about me in a nutshell.
That's awesome. Well, audience, just the other day, Dr. Eva was sharing on Instagram about her schedule because someone was like, how do you get so much PTO? I don't think people understand the life of doctors. Like, we don't, it's just different. It's just different. And so, you did a good job of explaining to them about the 7 on, 7 off. So you're able to plan your travel. And I really enjoyed watching you in Vietnam and all the stuff you shared about the culture. That was so fun. I think you celebrated your birthday and your wedding anniversary. So congrats.
Thank you.
Yeah. And since it's Women's History Month, I think that's so beautiful to celebrate how we are able to juggle all these things. And it makes me think about my favorite song, I'm Every Woman, because you clearly do it all.
It's not easy. Being a woman alone is already, something. And then being a Black woman on top of it, that's a double whammy. And being in a profession that we're automatically minorities, that's something else that we have to juggle. Having kids is another layer that we have to add to it, and then being a business owner and everything else, it's really not easy. I say that I think you can have it all. I
Mhm.
just don't think you can do it all. So I'm
Mm.
not doing it all. I do have a lot of help. I created my own little support system because I don't have family here and he doesn't have family here. So, and being in a profession that's super hectic and crazy, where the hospital gives you your schedule, and the hospital used to give him his schedule, and now he works for himself. So that makes things a lot easier on the both of us in our family setting. But like creating my own little support system by having people that help me. I'm outsourcing a lot. I'm Instacarting all the time, I get
Yeah.
someone to help me clean the house. Like it's really important to not force yourself to do everything by yourself because that is not sustainable at all.
I like that. I remember Oprah said a while ago, you can have it all, just not at once. And you just added that little twist, you can have it all, but not do it all. I like that.
Right. And I do think you can have it all at once.
Mm.
I've heard this before. Some people have said you can have it all, but not all at once. I
Mhm.
mean, I have everything I wanted all at once now. I mean, it took time to get to this point, but like I'm a physician, I wanted to be a doctor. I'm a wife, I wanted to be married. I'm a mother, I wanted to have kids. I'm a business owner, I wanted to do that too. So many things that I wanted to do, I feel like I have now. So this is all at once, but I can't do it all by myself. So I'm not doing it all
Amen.
by myself.
I got it. I caught that. All right. Well, we are celebrating National Hospitalist Day, and let me just share with everyone the post from the American College of Physicians. It says hospitalists are internal medicine specialists who spend the majority of their time caring for hospitalized patients. And a related fact they put is hospitalists can gain specialized knowledge in managing very ill patients and provide high quality, evidence based, and efficient patient and family centered care in the hospital setting. Internal medicine doctors, listeners, they know everything like the cardiology, the pulmonology, all those things that I bring up to you all is in Dr. Eva, and she consults all those specialists. She goes to the emergency room and admits those folks to the hospital. So this is where it all starts. So how did you pick this specialty?
Well, when I first started my internal medicine residency, I really wanted to be a GI doctor. So I
Okay.
went into internal medicine wanting to do gastroenterology. That was going to be my next thing, the fellowship, you know. And then life happened. I met my husband. I got pregnant my last year of residency. By then I was already in my third year of doing hospital medicine, and I liked hospital medicine as well, but I really loved GI so much. But then I was like, you know what? I don't feel like having to reapply to fellowship, not knowing where I'm going to move. I'm pregnant now. I like internal medicine, hospital medicine specifically. Let me just remain as a hospitalist. And so that's how I ended up where I am now.
That's great. Well, I have to tell you a little secret. Don't get offended. But when I was in internal medicine, I used to call the people on my GI rotation the poop patrol.
Because they are.
I remember having this is a joke, guys. I remember being on my GI rotation having KY jelly in my pocket to do you know what on every patient. I was like,
The
what
rectal
is this?
exams. Yeah, I remember. I remember those days. Yeah. I even thought even further. I was like, okay, when I'm done with GI, I'm gonna do hepatology. Like I had my mind all the way there. But
Whoa.
life had other plans for me, and I'm here now,
Okay.
which I probably have a better lifestyle that I would have had maybe if I was a gastroenterologist. I don't know, but I'm good now.
Good. Well, I thank you for bringing that up. And I want to define that for my listeners because, I talk a lot about, end of life care. And in my book, The Real Deal About Hospice, I actually have a chapter about someone who has liver failure. And so it's important for you all to know that the hepatologist I mentioned in that chapter is what she's talking about. It's someone who focuses on the liver, and you'll just have to read that chapter to learn about it. But it's important to note that folks with liver disease that it can turn chronic and end stage, and at some point their bellies are filling up with water we call ascites, like that patient in the chapter, and they have to get it drained, and we have to make some advanced care planning decisions. And a lot of times people come on the hospice with a peritoneal drain that we drain at home when they're at the very end stage, and they could have yellow skin and all those things. So this ties right into that patient. So thank you for bringing that up, Dr. Eva. Yeah. So, thank you for telling us how you picked that specialty. And are you doing anything special for Women's History Month?
Um, Nothing super special. I'm all about uplifting, inspiring, positivity, no drama type. That's just who I am. So I'm
Mhm.
just gonna continue to put that out there. I also want to increase the amount of minority women in medicine because I feel like we need to educate people out there because they feel a lot of people think that if you are a woman going into medicine, you're not going to have a life. You're not going to be able to have kids. You're not going to be able to do none of the things you want to do. You're going to have to put yourself last. And I want to show people that that is not true. You can really create and design the life that you want. And plus, we need more of us in this field anyway.
Yes.
So why, And
Yes.
so I'm gonna continue to do what I've been doing this whole month. Just be positive, uplifting, and that's what I do.
Well, I thank you because you really truly inspire, like even your workout videos, um, just everything that you do is truly inspirational. And I thank you for setting the example for us. I'm truly a fan. So before I let you go, if maybe you could maybe share a case when I like to tie everything back to hospice, and I know you do admissions from the emergency room. So some you may have seen, a hospice patient, they decide to come off and they show up in the emergency room, or maybe someone has been taking care of their parent and they come to the emergency room and they're like, I can't do it anymore. Like I've been taking care of my mom. She has Alzheimer's, it's end stage. Again, I'm sure you have something, but you want to maybe help us understand like how that would work, or maybe how you would talk to a family like this so that they can understand, you know, how they have help in the emergency room from you.
I just feel like there's a lot of layers to this. A lot of the patients that come to the emergency room that were on home hospice, I feel are not well educated as to what hospice is really. A lot of them accept hospice because they get a lot of resources, but not really understanding the true root of what hospice means and what that is for the patient.
Mm-hmm.
And so we see a lot of people in the emergency room, family members that bring patients that were on home hospice to the ER with little things like, oh, they can't breathe, or they're short of breath, or they're having chest pain, or their belly hurts, or, their blood pressure dropped, and so now I'm having to really explain to them what hospice means and what it means for that patient, and
Mm.
why this is probably a good option for them. And most of the time it's their first time hearing this or trying to comprehend that, oh, this is really end stage, that's why they're on hospice and this is what hospice means. Not just the resources that they're able to get at home, because, with hospice, you get way more resources than you usually would get with just regular home health. So a lot of families say, yeah, we'll take it because you get X, Y, and Z, a nurse, hospital equipments and all this stuff at the house. Um, but we do see a lot of family members bringing their, loved ones in because of that scenario, or they drop off their moms or dads, like you just said, at the hospital in the emergency room. And by the time I come to see the patient, there's nobody around because they're afraid that we'll discharge them back home. And
Mm.
so they pretty much just drop them off. And sometimes they don't even answer the phone for days. They're tired, or they have a trip planned and they want to go to Florida, or they want to do something, and you can't get a hold of anyone. And that's also because the system is very broken. It takes a lot to take care of a person that's sick 24/7. It takes a lot to take care of an elderly person that has dementia or memory issues, or someone who has a stroke who can't do for themselves. It's a
Mm.
lot on the caregiver. And I don't think there's a lot of resources out there for the caregivers. And so after a while, they don't know what to do. They're desperate. And their only avenue is to bring them back to the emergency room with a complaint, and then they just bounce. They leave. They're nowhere to be found. They go
Wow.
take a little vacation, and then they come back.
Wow.
But we do see both scenarios a lot, um, all the time. So I'm always admitting these patients. And I'm also on the rounding end when I'm not doing admissions, rounding on these patients where I'm seeing them and there's not much we're doing in the hospital, and we can't get a hold of the family. So they're stuck in the hospital. It happens. The healthcare system here is not perfect. Um, it's a lot that we need to work through.
Wow. Just hearing you say that, and all the compassion in your voice, of course, it just makes me empathize with their struggle, right? Like that must be a desperate situation where you feel like you have to do that. And so we have to do better, for patients and families. And, that's why I'm here too, so that patients know when it's time for hospice ahead of time. And so they are educated and equipped, or I say educated and empowered when it is time, and not wait until the last minute.
Right. Right.
Yeah.
Because
So
another
thank
thing
you.
I encounter too is when I do bring up hospice to a patient's family, because I think it's appropriate and we need to have that conversation, they look at me and say, well, you want me to let my mama die? So they automatically assume that this is you're gonna give up. You just don't want me to do nothing. So I have to really sit down and educate them and tell them what it means,
Mm,
and why it's probably the best option for them. And
hmm.
then most of the time, when I take my time to do that, their response is, okay, I understand. Let me speak to X, Y, and Z. Let me speak to my brother, my siblings, my kids. I'll let you know later or tomorrow. And I'm like, take your time. Talk to your family. I want you to make a decision that you're comfortable with so that you don't regret making a decision like this. Because, it's a major decision. And then come back and let me know if you want to have a family meeting with everybody else. I'm down. We can answer questions. We can talk about it. We can change the code status, and this is why. Like, it's all about education. But once you educate them, it's so much better. So much
Oh
better.
my gosh. Okay. So, listeners, this is what you should expect from your doctor. Okay. This is what she just said. It's not just me. This is coming straight from a hospitalist. So thank you. That was so powerful. My heart's beating fast. So before we let you go, I am going to put a link in the show notes to your website just so people can follow up with you. You are our valuable resource of the day. And I know you wrote two books. Do you have them nearby to kind of show
I
them?
do
I'm
right
an author
here.
too. I wrote two and you wrote two.
Yeah, that's
Tell
awesome.
us your books.
Yeah. So the first book I wrote is called Paging Dr. You, a step-by-step guide to becoming a doctor. And
Yes.
it's because when I finished residency and became a physician and then attending and was on my own, then I started looking back at my journey and realizing that a lot of the things I went through were not normal, even though they made you think it was normal. And I'm like, wait, I had to go through all of that, the microaggression and all this stuff, having to prove yourself, having to, work twice as hard. It was so much of a struggle that it didn't have to be. But then again, my journey was also different because both of my parents were doctors. I have a lot of doctors in my family. So even though I had to go through that, I still had them to support me, push me, to answer some of my questions, and I know a lot of people don't have that. They don't have anyone in their family that they know that are doctors. They probably have never seen a Black doctor and they don't know who to turn to. So, and there's no representation on TV, there's no representation in the books. So I decided to write something real simple
Yes.
for as young as middle school, not complicated at all, to kind of tell you what you need to do now to position
Yes.
yourself for success. And it's simple things like don't do nothing crazy on social media because it can follow you along when it's time for your interviews for undergrad or any interviews, or start working on your credit early because medical school is not cheap. And most likely you're going to need to take a student loan. And you don't want that to be the reason why you can't be a doctor, right? So it's just really simple things, volunteering, what's considered clinical work, what's considered not clinical work, what major you need to do, and little things that's really simple, but major at the same time. So that's
Ye-
this. And then
Yay.
for fun, it
I'm
was
getting that for my daughter. She's pre-med.
Everywhere There's a Hurt. It's a children's book, and it's about a pediatrician who's a Black woman. She has kids, she's married, she goes to work, and she fixes little kids. She fixes boo-boos, she makes them feel better. And the kids can read it and have a different perspective of their doctor because she's so nice and the kids love her. Because a lot of kids are scared of their pediatrician. And so the book will kind of make them feel more at ease about their doctor because it's fun. And they get to see the little kids feel better and they get to see themselves represented in the book at the same time. And so just something fun for the kids.
Well, I'm getting both of those books, the first one for my daughter and the other one for my granddaughter.
Thank
Thank
you.
you for
And they're both available
everything.
on Amazon.
Yay. All right. Well, I so appreciate you being here. You have dropped some gems. We celebrate you for Women's History Month. You are making history, showing us how we can have it all. And you're inspiring. So I thank you and happy Hospitalist Day.
Thank you so much for having me.
All right. Signing out on this bonus episode 40 of Dr. G at the Heart of Healthcare. Peace. Deuces.